Going to introduce our first speaker, Carrie Aaron, who is not Karen, but in fact Carrie Aaron, as I accidentally called him one day. He's the Executive Director of Medical Affairs at Zogenix. They're doing a trial with fenfluramine, something called ZX008, and he's going to talk about specifically who they're working with this trial, what they're doing, what they've accomplished so far. So with that, Carrie, come on up.
Hi everybody. Thanks, Tracy. Okay, so I'm kind of going to do what Tracy said. I'm actually going to take you guys on a journey, 40-year journey, which the end of the journey actually culminates in some clinical trials that I'm going to tell you about. But I'm hoping some of you are here because you've heard about fenfluramine or you've heard about staccato alprazolam and you want to learn more about it. There's a story behind fenfluramine that a lot of people don't know, and I think it's really important to tell that story in addition to letting you know about some of the data that has been generated recently. So that's why it's titled A History in Epilepsy from the 70s until now. Now, we'll see if we can make this work. Okay, this story goes back to the mid to late 70s. And at that time, in France, there are a couple of pediatric neurologists who are absolute giants in the field of not only pediatric neurology, but pediatric epilepsy specifically. One of them is a Dr. Gastaut. I'm sure many of you have heard of Lennox-Gastaut syndrome. And the other is a Dr. Accardi, who recently passed away, but he also has a epileptic syndrome named after him, Accardi syndrome. It started with Dr. Gastaut kind of dabbling with fenfluramine. This is back when it had initially been approved literally worldwide for use in weight loss in obese adults. Many of you probably remember fen-phen. Fenfluramine was one of the two phens that were in that combination of drugs that adults were taking at much, much higher doses than what I'm going to be talking to you about here. Dr. Gastaut, he started out for whatever reason, we really don't know, he's not alive anymore to ask him, but he thought that there might be some utility with fenfluramine in children that had severe psychiatric and behavioral conditions. And he started testing it, not necessarily in a controlled trial sort of a way, but just in his clinical patients. And lo and behold, what he found out was there were some effects when it came to behavior, but he found that many of his patients not only had these behavioral issues, but they had concurrent epilepsy of one type or another. And he found that these patients' seizures were decreasing, and many of them quite dramatically. So fast forward to the 80s when he and Dr. Accardi wrote just a simple letter to the editor, to the New England Journal of Medicine, and they reported on 3 patients that had what is called self-induced photosensitive epilepsy. It didn't have a better name than that back then. Now it's known as sunflower syndrome. Kids and oftentimes adults will cause themselves to have seizures by kind of creating a strobe effect, by looking up at the sun or looking up at lights and doing this, and it induces a seizure. And Dr. Accardi and Dr. Gastaut reported on 3 patients that did very, very well with fenfluramine. That led to Dr. Gastaut teaming up with another doctor in the US to report on patients that had, as it was described, severe childhood epilepsy. It wasn't a particular type of severe childhood epilepsy. And the results that they reported on were fairly impressive. Half of the patients, of the 33 patients that they put on fenfluramine, half of them had a response reducing their seizures by at least 50% or more. And that kind of encouraged them to continue on and look at this drug. So the story then switches from France to Belgium, and the reason that it does is there are a couple of doctors, Dr. Boule and Dr. Kazar, which looking at those names you wouldn't think they're pronounced that way, but that is, I've been told, the way that they're pronounced. These 2 doctors trained under Dr. Accardi in France, and so they were exposed to his use of fenfluramine in these childhood epilepsy populations. And so they continued to look at fenfluramine in Belgium at their institution. And there's a couple of papers here. One was in very severe institutionalized pediatric patients. It was a total of 11 patients, but the results that they had with fenfluramine were nothing short of remarkable. Literally all of these patients responded in some way or another. 7 out of the 11 became seizure-free. The remaining 4 patients had at least a 75% improvement in their seizures. That was quite remarkable. Now keep in mind, these are not controlled studies. There was not a placebo arm to compare to. These are what are called open label studies. So you take some of these results really with a grain of salt. They moved on and published another paper where they looked at a larger number of patients, 22, and again, with pretty stunning results. Out of those 22, 6 did not respond, but 16 of them had 90% or more improvement in their seizure frequency. Again, you know, a very remarkable response in a patient population that was very difficult to treat. So those 2 papers were published in 1996 and 2002. While those studies, if you will, were going on, something very significant happened with fenfluramine. In 1997, it was taken off the market, and it was taken off the market worldwide, including Belgium. And so here, these doctors had these patients that were doing remarkably on a drug that was threatened to be taken away from these families. And so this is the silver lining in this story. The silver lining is that these doctors were studying this drug in the country of Belgium. The reason being, Belgium is a kingdom. And in a kingdom, or at least the kingdom of Belgium, you have the opportunity to actually appeal to the king and ask for something called a royal decree. And that's exactly what these doctors did. And these are the doctors that are on the bottom here where it talks about 2002. These are Dr. Sulemans and Lagai, who studied under Dr. Bull and Kazar. So this is kind of a generational bit of a story. But these latest doctors in Belgium went to the king and said, we have this population of kids that are doing incredibly well, and this drug is going to be taken away from them. And the king came back, the government, whatever you want to call it, came back and said, you can continue studying this population of patients and you can add more patients as long as you have a source for the fenfluramine. And they were able to find a company in China that was willing to make the fenfluramine for them, and they continued on studying these patients. Something else very important happened in 2002, and it involved these same 2 doctors down here on the bottom. I have a pointer, but it's probably hard to see. These doctors were part of the group that discovered the genetic, they didn't discover the genetic defect, but they discovered that a particular genetic defect is associated with a type of rare childhood onset epilepsy syndrome that many of you may be familiar with. It's called Dravet syndrome right now. It was not called Dravet syndrome yet back then. And they were able to go back after they discovered that this genetic mutation is associated with these patients. They went back to their original population of 11, and they found that 5 out of those 11 actually had Dravet syndrome. They had that genetic defect. They also had another patient that, although they did not, the genetic defect had not been found at that point, the patient had a clinical diagnosis of Dravet syndrome. So they had 12 patients that they started out with, and they continued to keep on fenfluramine, and they continued to follow them. Now keep in mind, this goes back to the late 80s. In fact, the first patient that they followed started in 1988, 30 years ago. So we have 30 years of data on this drug that is not available anywhere in the world other than in this special use population in Belgium. And that's a very unique situation to have when you are trying to develop a drug for a particular disease entity. So at this point, these 12 children were followed up until, from 1988 until 2010, and then this paper was published in 2012. At this point, in 2010, these patients ranged from 3 to 35 years old. So we had new onset children at 3, and we had adults that had Dravet syndrome for many, many years. Again, one of them was 22 years old. The ages ranged from Yeah, 3 to 35, they had been on the drug for between 1 and 22 years. The results in this study mimicked what had been seen earlier in France. About almost 60% of these patients had been seizure-free for at least a year. Now, these are Dravet patients. We know the diagnosis for these patients, and Dravet is a very severe epileptic syndrome. To be seizure-free for a year or more is pretty unheard of in that population. So that was 7 of them seizure-free. One of them had a 75% reduction in their seizures. One patient, it was difficult to get a continuous supply of this drug from China, and so there periodically were outages where they couldn't get the drug. One of these patients, when the drug was no longer available, actually remained seizure-free, and so they just stopped fenfluramine, and that patient has been seizure-free since. And then there were 3 patients out of the 12 that there didn't appear to be an effect, but many of you who are patients here, or are parents here in the audience, will probably understand the unwillingness of 2 out of these 3 parents to take their child off of fenfluramine for fear that if they stopped it, their seizures would get worse. So only 1 of all these patients actually stopped the drug because it didn't seem to be working. Now we move forward to 2015, and it was actually 2014 when Zogenix got involved and licensed the rights to fenfluramine to be able to develop it for use worldwide in Dravet syndrome, and now we're looking at its use in other types of syndromes as well. So the first thing we wanted to do when we took this medication on was we wanted to know, how are those 10 patients doing now that it's 2015? So we're 5 years down the road from where they were when that paper was published. So we looked at those 10 patients. Now their ages ranged from 9 to 41, and on average they were 25 years old. You can see the dose. I'm not going to go too much into that, but I think it's important to see that at this point they had been on treatment for an average of over 17 years, ranging from 7 to 28. At this point, the numbers again are consistent. 70%, 7 out of the 10 patients, had experienced prolonged periods of seizure freedom. 3 of them, now again, we're looking for that period between 2010 and 2015. 3 of the 7 were seizure-free for that entire 6 years. The remaining 4 of those 7 had seizure-free intervals of at least 2 years during that study period. And I'm going to show you those patients here in a second. From a safety perspective, this is something that we're really watching closely, and we were watching it closely even back when we were doing this study. We need to be assured that these patients that are taking a much lower dose of fenfluramine than was used for weight loss in obese adults, we need to make sure that these patients are not going to develop the types of cardiac problems that was the reason that the drug was taken off the market in 1997. So these patients are followed very closely with what are called echocardiograms, where you can look at the internal workings of the heart and be able to determine whether or not they have something called valvulopathy, which is it's a disease where your valves inside your heart become leaky, and instead of the heart pumping and all the blood going forward, some of the blood leaks backwards through these valves that are misshapen. That was one of the problems that the obese patients got into. The other problem was something called pulmonary arterial hypertension, which is basically just high blood pressure in your pulmonary blood circulation. You can see down here that although some of these patients showed types of minimal cardiac effects, none of these effects were the types of valvulopathy or pulmonary hypertension that had been seen in the adults. So things continued to move forward. Here's those patients. And again, I'm not going to go into detail, but you can see each of those dots on each of those graphs is how many seizures those patients had in a particular year over that 6-year period. So it just kind of gives you an idea how these patients are doing many years down the road after they started the drug. The other thing that we did when we took this on was we said, okay, well that's great that we're continuing to follow those patients that have been on the drug a long time, but we need to start some newer patients on it. We need to know how these patients do from the get-go. Now that there's actually truly a pharmaceutical company involved, and we can do more relative to making sure that we've got a protocol to be followed. here. And so what we did was we developed, again, an open label study. This is not a blinded, placebo-controlled study. But we followed these patients. We first looked at how many seizures they were having over a 3-month period, and then we started them on the fenfluramine. And we then compared the number of seizures that they were having on an ongoing basis back to the number of seizures that they had back in that what's called a baseline period. And you can see here the different types of things that were looked at. Not only were we interested in the numbers of seizures, but we were interested in the safety information as far as those echocardiograms as well. And here's how we looked at those echocardiograms. Essentially, the first year they got an echo, it's abbreviated echo, every 3 months during that year. The second year they got it twice during that year, and then from the third year on they get one a year. Here's the results as of, when was this? As of 2017. And this shows 11 patients that were started on fenfluramine. These are not the patients we were looking at before. These are new patients. Each one of those bars is an individual patient. And it's kind of deceiving because the bars go downward, but the further down the bar goes, the more decrease the patient has experienced in their seizure frequency. And you can see all of these patients except for one, patient number 6, had at least about a 70% reduction in their seizure frequency. Again, that 70% number keeps coming up. There's a special circumstance about that patient number 6. That patient actually was seizure free up until the point when he broke his leg, and he had to have surgery to repair the leg, and he totally lost seizure control at that point, and they weren't able to get him back to the point where he was seizure free. This is the same data, but looking at it in a different way. This is looking at it over time. And so over time, these 11 patients had been on fenfluramine for varying periods of time because they're constantly coming into the study. But you can see from patients that were only on the drug for 3 months up to patients that have been on the drug for almost 3 years, the decrease in their seizures in any given time point is about 60% or greater at any time point. Again, the numbers are actually amazingly consistent at this point with this open label information. Safety-wise, there was nothing to speak of. With all those echocardiograms, there was never an echo that indicated there was any valvulopathy or any pulmonary hypertension. So I'm going to skip over the conclusions because I don't want to give our second speaker a less amount of time. So I'm going to move on. The conclusions basically stated what I've already told you. So now we're going to fast forward to the present day and what Zogenix, the company that I work for, is doing as far as a clinical development program. We're trying to get fenfluramine approved for various conditions. And the first condition that we're looking at is Dravet syndrome. That's what those kids in Belgium had. And you can see the different types of studies that we have done and are doing in that area. I'm not going to go into great detail there. And then we're also embarking on what would be called a second indication for fenfluramine. We're also looking at another severe refractory childhood onset epilepsy, Lennox-Gastaut syndrome, and that study is actually ongoing right now. And at the table that I'll be manning outside, I have information, recruiting information. We're trying to get more patients into that study so that we can get through that process and then apply to the FDA for approval for that condition as well. So what I'm going to go through, and this is the only placebo-controlled study that I'm going to go into any detail. I'm not going to go into great detail, but this was the first Dravet syndrome study that came out, and this was presented last year at the American Epilepsy Society. This will be published in a journal, hopefully in the near future. It's being evaluated by a journal right now, but this is the first of 2 studies that we looked at in Dravet syndrome with fenfluramine. I don't want to, go into too much detail, but the design of this clinical trial is very similar to just about any other epilepsy clinical trial that you may have heard of or may be involved in. There's a period of screening where we make sure that a patient is truly eligible to be in the study. They need to have a certain number of seizures during that what we call screening period, because if they don't have a certain number of seizures, it's really hard to tell when you put them on the drug that there's been a difference. So you need a certain number. And then we observe those patients for 6 weeks, looking for that number of seizures and various other parameters. And then randomization occurs, which just means they're given, in this study, one of 3 types of drug. One would be placebo, which means it's nothing, a sugar pill, or in this case, sugar water. Or 2 different doses of fenfluramine. And the reason we studied 2 different doses of fenfluramine was we looked back at that Belgian population, and it's really interesting because all of those patients started out as kids, but over that long period of time, 30 years, they became adults. And so they got bigger, they got heavier. And so relative to their weight, their dose of fenfluramine actually decreased. We look at dosing based on body weight. It's so many milligrams per pound or kilogram. And so as these patients got bigger, they were taking less milligrams per pound or kilogram over time. So we wanted to look at the whole range because they had been on truly low dose fenfluramine when they got to be adults. When they started out as little infants, they were on a relatively high but low dose. And I say high but low compared to the original dose in obese adults. So the randomization occurs. You're basically not going to know which of those groups your child has been randomized to. And then for 3 months, they're followed. And obviously, you look at the number of seizures. You look at their echocardiograms and a number of other things. And then the study is essentially ended as a blinded study, and then everyone gets the opportunity to get the drug in an unblinded way where everybody knows they're getting the drug. And that's the open label safety study that you see on the right there. So just to kind of cut to the chase with this study, the main endpoint or the outcome that we were looking for was looking at the higher of the 2 low doses, it's 0.8 milligrams per kilogram per day, and how did that measure up with the placebo group? How much more seizure reduction did these patients have in that fenfluramine group? Well, it was a 63%, 64% greater reduction in seizures than was seen in the placebo group, which is quite significant when it comes to a placebo-controlled study in this patient population. I want to also say that on average, the patients that came into this study were having, I have 3 minutes, the patients that came into this study were having on average 40 seizures per month. So think about a 60% reduction. It's pretty significant. We also look at not just the average, but we look at what's called the median, so that it's another way to look at sort of the middle of the group, and there's half as many had lesser reduction and half as many had a greater reduction. When you look at it that way, 72% in the higher dose group, 37% in the lower dose group, and 17% in the placebo group. Those were the reductions in their seizures. And these are, you look at statistics, the higher dose group was highly statistically significantly better than the placebo group. Okay, I'm going to skip over a couple of things. I'm not going to skip over this one though, because a lot of people are familiar with this. I even mentioned it earlier. Oftentimes we look at, so what was the percentage of the patients that had at least a 50% reduction in their seizures? And the reason we look at that is because we think by having the number of seizures, that probably would be a clinically significant result. And in this study, in the higher dose group, 70% of the patients had at least a 50% reduction in their seizures. And then we looked at another endpoint that is much more rigorous. And we looked at it because of the results from Belgium, because there were patients that were getting a 70% reduction. We looked at how many patients had a 75% reduction in their seizures or greater. And it was 45%. It was almost half the patients had their seizures cut by 75% or greater. I'm going to skip over this. We also look at seizure freedom and what we call near seizure freedom. Over the entire 20 weeks of this study, how many of these patients went from, on an average, 40 seizures per month to having 0 or 1 seizure per month? And in the high dose group, it was a quarter of the patients. Again, pretty significant. This is a complicated slide. I don't have time to go through it, but I'll point out where the 2 numbers are circled. There's something there, it says OR, that stands for an odds ratio. That says that if you were in the high dose group, you had a 29.1 times greater chance of having that 50% reduction than those in the placebo group. In the 75% or greater group, you had a 50 times greater chance of having that 75% reduction or greater than the placebo group. Those numbers are actually unprecedented. I'm going to skip over the safety, not because it's not important, it's actually incredibly important, but because we haven't seen anything. Again, we have not seen any clinical valvulopathy or pulmonary arterial hypertension in any of these patients now in the blinded studies as well as those open label studies earlier. The other thing that was really good news for us is this second set of numbers here. The number of patients that had at least one serious treatment emergent adverse event, it actually was similar across placebo and the two doses. That is really a comforting thing to find out about when you're doing clinical trials. Tracy's given me the hook, so I skip over conclusions. I mentioned there was a second study. The difference in this second study is that these patients, also Dravet patients, they were taking a drug called stiripentol, which was recently approved in the United States. In the first study that I went over the data with you, patients on stiripentol were not allowed in that study. So this second study, we wanted to see how things went with stiripentol. And here's the bottom line. There's that comparison graph again. 63% of the patients on the high dose fenfluramine, or not 63% of the patients, but those patients on the high dose had a 63% reduction in their seizures. The patients on the placebo group had a 1.2% reduction, which is a sign that this is a very difficult patient population when only 1% respond to placebo. Usually placebo response is quite a bit higher than that. So I will stop there. I'll thank you. If anybody wants to talk more about fenfluramine, the study in Lennox-Gastaut, I'm going to have a booth out there as soon as my tablecloth and handouts arrive. Right now it's just an empty table. But thank you very much.